In many cases, piles manifest many times for the first time in the pregnancy. Why piles is common in pregnancy? What to do as a home management for piles? Does piles affect unborn baby, or does pile affect the normal delivery process? What is the treatment of pile? What are the medicines for piles? Is surgery required in piles? Can surgery for piles be done in pregnancy? We'll discuss all these things in today's video. Good morning, I'm Dr. Rajat and you've started watching our YouTube channel, The Fertility Gynecologist. First of all, before coming to the management and the home remedies for piles, let us understand what are piles. Piles are basically the herniation of blood vessels of rectum and anal canal. Any factor which increases constipation, any factor which increases straining at stool, any factor which increases intra-abdominal pressure may lead to the development of piles. Many people have this false belief that by eating this or eating that, eating spicy food or eating any garam food, the piles increase or the piles appear for the first time. That is not a factor. So first and foremost, let's be clear, any females who are constipated or who have constipation before they are pregnant, they are at increased risk of developing piles. Any factors which increase constipation, like I discussed in my constipation video, nowadays our diet and lifestyle plays a major factor in the constipation part. First of all, the use of western toilets has increased the incidence of constipation in pregnancy and thereby leading to the increased incidence of piles. So for all those females who have got western toilets at their home, I would recommend, I'll put the photograph in the video also, that you should put at least 12 inches to 16 inches stool beneath the legs and you should place the foot on that stool and then go and pass the stool. That will decrease the chance of constipation and thereby the piles. Also increase fluid, increase amount of fluid, plain water, lime water, coconut water, soups, juice, buttermilk, whatever. What that increased fluid does is it increases the amount of stool and thereby it increases the passage of stool. And also plenty of fiber in the diet. Any amount of salads should be taken. And avoid any processed food, especially which includes maida. Take plenty of fruits. So the moment the constipation is decreased, then the chances of symptomatic piles, the chances of pile increasing, they decrease. Pregnancy also has got hormones and the mechanical factors which increase the incidence of piles. Pregnancy is mainly supported by a hormone called as progesterone. Progesterone leads to the stasis or the decrease in the motility of intestines and thereby it increases the incidence of constipation, thereby the piles. And after 3rd month, 4th month, 5th month, the pressure of pregnant or the gravid uterus on the inferior vena cava or on the blood vessels, they lead to the back pressure and thereby the increase in the varicosity of the intestinal veins and thereby leading to the increased chances of hemorrhoids, as we call it in our medical jargon, or piles. So what are the symptoms of piles? If mostly the piles simply present as a swelling, which mainly for the first time manifests during the straining, a swelling, a soft swelling which comes and goes, especially during straining at stool. Because there are 3 degrees of piles, 1st degree, 2nd degree, 3rd degree. 1st degree is the swelling does not manifest. Even at the straining of the stool, the swelling does not come out. 2nd degree is at straining it comes out slightly and then goes back again. And 3rd degree is the swelling will remain in spite of even after the straining. So Initially, the only symptom may be swelling. Later on, because those piles or hemorrhoids are the collection, the swelling of blood vessels, there is blood inside them. And if there is a constipation, the moment there is a passage of stool, hard stool, which goes through and passes through this swelling, that may lead to some amount of thrombosis, that may lead to some amount of clotting of the blood in those blood vessels. And thrombosed pile, when the stool passes through, it becomes painful. Sometimes the passage of hard stool from the thrombosed vessel may rupture the vessel and there may occur bleeding, and that may lead to bleeding. So the main symptom of pile is swelling, followed by pain if it is a thrombosed pile, and occasionally there may be bleeding. So these are the main symptoms of piles. Do piles get worse when pregnant? Yes, answer is yes. What is the main problems with piles? Like I said, swelling, pain and bleeding. What habits cause piles? Any habits which lead to increased constipation. Lifestyle factors include sedentary life, using more of a western toilet, less fluids, more dehydration, and in India there is a tropical climate. India is a tropical country. There is more dehydration. So if you are not taking enough fluids, if you are not taking enough fibers, if you are taking in an increased quantity of processed food, that may lead to increased chances of piles. Most of the people can come and ask me, can piles reduce normally, naturally? Answer is no. Pile is basically a herniation of veins of rectum and anal canal. Once that herniation has occurred, that cannot become normal again. But if you prevent the progression of that herniation, then the increase in the degree of piles can be prevented, and thereby the constipation has to be prevented. Can piles shrink off by themselves? Answer is no. What happens if you don't remove piles? Say if it is a first degree pile. And like I said before, piles is mainly caused or aggravated by the increase in the amount of intra-abdominal pressure. So if you control that factor which increases the intra-abdominal pressure, like straining at stool, like increased cuffing, like increased lifting in heavy weights, then the chances that piles may progress would decrease. And if you improve your bowel habits, that piles may not progress further and you can manage the piles. First stage of piles, I've already told what it is. What should be avoided with piles during pregnancy? You should avoid either sitting or standing in the same posture for a long time. Go for a good long walk. Walk will stimulate the intestinal motility, thereby would help with constipation. It will help in the passage of relatively easy passage of stool. Increased fluid would again improve the intestinal motility, and if you improve the constipation, then the piles would get relieved. Can piles affect the baby during pregnancy? Answer is no. Piles have no effect whatsoever in the pregnancy, in the baby, or during the normal delivery. Do you recommend removal of piles during pregnancy? As a gynecologist, unless it is very severe, very weak thrombosed pile, stage 3 pile, we do not need to do a surgical management of piles in pregnancy. We just need to do a conservative management of piles in pregnancy. That comes to my next question. What is the conservative management of piles? Apart from dietary and lifestyle modifications, which I mentioned before, a regular use of a stool softener, especially the liquid paraffin based softener, what that liquid paraffin does, it forms a coating of slight oil or fat around the stool, and that makes it easier to pass, and the passage of stool from the rectum and anal canal becomes relatively easy. Also, hot seats bath should be used regularly. Hot seats bath means take a warm to hot tub of water, put 1 to 2 spoonsful of any antiseptic like Dettol or Savlon in it, and ask the female to sit for 15 to 20 minutes 2 times a day. What that antiseptic does is it will prevent the infection of the piles, and it will also act as a hygroscopic agent. It will relieve the pain. We also use some kind of a local anesthetic cream like lignocaine jelly, which helps in the relief of pain. And sometimes any kind of a tranexamic acid or ethamsalic acid or a venusmin kind of tablets helps with bleeding piles. These are the conservative management of piles. If there is an edema, there is a swelling, we can use glycerin myself to decrease the size of piles. Who treats the piles? Normally, a surgeon is the one who treats the piles. Gynecologist usually does not treat the piles. Can piles affect delivery? Answer is no. Piles does not have a direct role in delivery. Can you have a normal delivery with piles? Very, very, very much yes, you can have a normal delivery with piles. Piles does not affect the way in which the delivery occurs, either a normal delivery or a cesarean section. Sits bath, I have explained how long do the piles last in the pregnancy. Once the piles has occurred, it will last throughout the pregnancy, because like I mentioned, pregnancy has got a hormone which is called progesterone, which is causing the intestinal motility to decrease, and the pressure of pregnant uterus. These are the two factors which will increase the constipation, and they would act as a aggravating factors for piles. So at best you can manage piles in pregnancy, but you can't treat the piles in pregnancy. For a definitive management of piles, normally what we advise is, for all those females who have got piles in pregnancy, we advise to wait for 6 weeks after pregnancy and then visit a surgeon. Surgeon would go for a proctoscopy or a sigmoidoscopy and would see at what stage the piles is. Does it require a definitive management or not? And definitive management nowadays is a very simple. It is a simple band ligation. That is a daycare procedure. It hardly takes 15-20 minutes. The patient can be discharged in a single day. Will piles go away in pregnancy? I have already mentioned it won't go away. Will my piles rupture during labor? If there are thrombosed piles, then there is a very definite chance that piles may get ruptured or during labor. How big are the piles in pregnancy? They differ. From a size of a peanut to the size of a golf ball, they differ. Every patient has got different sizes. Do piles clear by themselves? Answer is no. Will piles affect the chances of getting pregnant? Again, answer is no. Why the piles hurt more at night? Now, this is a very, very important question. See, in the day, the female is doing all sorts of things, doing household chores. If somebody is working, somebody is doing some work, mind is diverted. At night, mind is relatively free, so you feel more pain. And again, the pressure of the gravid or the pregnant uterus on the intestine, that leads to the increase in the stretching of soft tissue, and thereby leading to the increase in pains in piles. That is why the piles hurt more at night. Can piles spread? Answer is no, it does not spread from one person to another person. So the dietary management should be: drink plenty of fiber, drink plenty of fluids, eat plenty of fibers. All types of fruits can be eaten. Which should be avoided? All kind of processed foods, all kind of food which comes in the packaged food. Especially avoid dairy products, spicy products, all highly salted foods. All kinds of liquids are better, but I would personally recommend to avoid fruit juice, buttermilk, curd, vegetable juice, soups, lime water, coconut water, plain water. Anything can be taken. Which fruit is better? Any fruit which has got increased amount of fiber, like pears, like banana, like kiwi, like strawberry, grapes. Everything is better. Can you drink milk with piles? See, 1 to 2 cups of milk should not matter much, but in some people, milk, if it does cause constipation, then we avoid the use of milk. Curd is an excellent source of probiotic. We always advise for patients with piles. We do not advise to take Caffeinated beverages like tea or coffee, much 1 or 2 cups per day is fine. Can egg be taken with piles? Egg is a good source of protein. It is a very healthy food. It does not either affect piles in a good way or a bad way. So taking of egg would not matter much in piles. Whole grain cereal can be taken. Watermelon is a good source of fiber. It also is a good source of fluid. Muskmelon is also very good. Carrots are excellent, beetroots are excellent, cucumbers are excellent. All these fruits and vegetables contain plenty of fluid and fiber. Non-veg ideally should be avoided in the people who are having piles. Banana is an excellent source of fiber, is an excellent source of vitamin B complex. So we would recommend eating 1 to 2 moderate size banana. How to sleep with piles? We would not advise to sleep on lying down on back. We normally advise to sleep either on right or left, preferably left side, and like a baby is cuddling position, knees to the abdomen and elbows to the abdomen. That will relieve the pressure of the uterus on the intestines and blood vessels and thereby relieving pain. Is it better to sit or stand for a long time? See, sitting is relatively difficult with piles. So there are coccygeal cushions which have come, which have got a hole just in the center to prevent the pressure of the body on those things, and rest can be managed. But there should be, even the prolonged standing should be avoided. You should not be in the same position for a long time. Is walking useful for piles? Walking directly does not benefit piles, but what walking does is, walking is basically a good exercise for the intestinal motility. Bowel motion increases, it decreases the chances of constipation and thereby helps in piles. Do you need bed rest with piles? I would say if there is a bleeding pile or if there is a severe pain, you can take a couple of days of rest, but a complete bed rest is not necessary. For immediate pain relief, use some kind of an ice pack or a cloth wrung in the ice water. Thereby you can use it for pain relief. Again, I said how to sleep. You sleep on one of your sides. Which toilet position is best? I mentioned Indian toilet is best. Please do not use western toilets. If for some reason you have to use western toilet, use a 1 feet or a 12 to 16 inch stool with a footrest. You rest your foot on that stool and then use those things. Which exercises or activities should you avoid? Any exercise or any activity which increases intra-abdominal pressure, like lifting of heavy weights, like jumping, heavy intensity sports, cycling, should all be avoided in piles. Is it okay to sit with piles? You can sit, that's not an issue, but cross-legged position would be relatively better. And like I said, use some kind of a coccygeal cushion or this thing with this. What heals piles faster? Lifestyle and dietary management is best. Conservative management with hot seats bath, with regular use of laxatives or stool softeners, and on tablet venusmin for bleeding on an SOS kind of basis, and the application of a local anesthetic gel. Various combinations are available for on SOS basis. Best treatment of pile, I have again mentioned, the definitive management is surgery, but that surgery has to be postponed till 6 weeks after delivery. We normally do not recommend any kind of surgery during pregnancy. Best cream for for the management of piles, I have again mentioned. Uh, the various components. The main component is a local antibiotic, a local analgesic, and local anesthetic gel. It will basically help in the relief of piles. I'll mention in the video the link of cream which is available, the link of coccygeal cushion which is available for the management of piles. Hope you enjoyed the video. Please subscribe to our channel, like the video and share the video. Thank you. Namaskar. Bye bye.